always the most important thing is that you're changing positions more so throughout the day. You're catching yourself when you're really coming forward, and what are you doing to bring your body out of that? Welcome back to another PT Pearl from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about disc herniation, specifically in the neck. So we've talked about it in the back before, but now we're going to talk about it in the neck and what you should do about it. Now, before we dive in and talk more about those cervical disc herniations, we do have one about the lumbar spine, your low back. So click wherever that is going to pop up on that podcast episode, because we also go into a lot of the research and science behind what it's now saying you should do for back herniations. But also don't forget to please subscribe. So if you hit that subscribe and that bell, you're going to get notified as to, we don't know where it is. You're going to get notified as to when we go over these topics on pain and what you could do about them. I mean, we have this natural curve that kind of does drop the spine forward, and then the upper back drops and rounds back just a little bit. So we have a normal curve and flexion, and then it reverses as we come up to the neck so that we can look up and our spine is quote unquote neutral. So that's a neutral spine. It's not a straight spine. It actually has these normal curves about it. However, it's when we start to either lose those curves that, it tends to then go into a decreased space between those vertebrae. In the spine, in the neck, I should say specifically, what tends to happen is that we tend to lose that natural lordosis, that curving of forward in the neck, because we tend to look at phones all day long or down at computers, and we're straightening out that spine. And what that straightening is doing is kind of flexing as opposed to, or it's straightening out, but it's just narrowing that space that we have between those vertebrae.
People who have less of that lordotic curve, or even have a kyphotic curve, meaning rounding forward in their neck, is a little bit more predisposed or may have a higher prevalence or correlation to having some of these cervical disc herniations.
It's also, important to note anytime we're talking about disc herniations is that it is almost a natural degeneration of the spine that tends to happen as we age. And it's unfortunate, and it's going to become, I think, more common the more that we're involved in technology. And now we see children bent over their iPads for homework and bent over computers. And so we're starting from a much younger age now that we're in this technology phase. Pain doesn't have to be normal. We can have solutions of how we continue to work through this. However, seeing this image doesn't mean that you're abnormal. And I think that's important to know.
Yes, you can have symptoms and the image can show up and say, oh man, you have this crazy cervical disc herniation. That doesn't necessarily mean that the image will ever go away. We could image you 5 years down the road when your pain has been long gone, and they might still say, oh, you're still showing a little bit of a disc herniation in these levels. And that's okay. Because again, as long as you are relatively pain-free and you have found a way to manage that pain if it ever comes up, or do things to find stability in that neck, great. And there's 4 different stages. I'll go through quickly. Disc bulge, essentially showing, hey, we're seeing some of that nucleus pulposus displacing backwards into those annular fibers. Number 2 is protrusion, which, or a protruding disc, means it's pushing into the fibers, and we're seeing the nucleus pulposus make some ground, maybe even through some of the fibers, but it hasn't completely broken through the annular fibers yet. Extrusion, or an extruded disc, is showing that some of that nucleus pulposus has actually made it through the annular fibers and is now poking into the spinal canal. And a sequestrated disc is when some of that nucleus pulposus actually becomes detached and becomes more of a floating body in the spinal canal. Another nerve injury, of course, we associate it with words like tingly, burny, numbness. Sometimes that's where we'll progress into shooting type pains. Again, like Jen said, we aren't necessarily going to feel it at our neck all the time.
Yeah.
Like the C8 dermatome is the one that's all the way down kind of on our pinky side. So you might just be feeling it on the pinky and the inside of your forearm. And that's where a lot of the times you'll go into a physical therapist and they'll start messing around with your neck, and you'll feel a difference in that pain.
Yeah.
And it'll seem like voodoo magic, but really that's where the issue is up at the neck. You're just feeling the symptoms downstream in the hand.
Anytime you have a nerve type issue, it is so important to go see a physical therapist in person. And you won't really know until you get it properly assessed, because just trying to move your neck around and kind of see what's happening might not be the thing we just don't want you to mess around so much that you're really kind of exasperating pain issues.
There are a lot of contributing factors when you see the people who do end up showing up with these and having symptomatic versions of these cervical disc herniations. It tends to be people who may have had trauma in the neck or may consistently go into end in extreme ranges.
We're not just talking about sustained pressures here. Yes, if you're sitting in front of a phone or a computer for a long extended period of time, or you're working like over a person, but also if you're going into forces and range of motion that is exceeding what your body can tolerate. So whether that is from strength, the ligaments that are around the area, if you're going into a range of motion or into a force like in these pilots that can't sustain that pressure, well, then we're going to get to an area that becomes weakened in the tissue that can be more prone to injury like disc herniations. Always the most important thing is that you're changing positions more so throughout the day. You're catching yourself when you're really coming forward, and what are you doing to bring your body out of that? Or you just did surgery, or you're just working on a client who came in as you're a dentist or anything like that. Well, what are you doing directly after that? And that's going to be what's most impactful, is what we're doing more so throughout the day, rather than just continuing to repeat these patterns and falling into this pain pattern over and over again.
Even if it's because you work at a computer and you've just been working for a long time, when you have a break, what's it feel like to completely open up the arms and open up the chest and extend your neck back a little bit, right? And do that 10 times and then get back to work. You know, doing something like that consistently, or if you take a break every hour and do something like that, that can be what starts to move the needle and moves your normal a little bit more from that forward flexed position to a more natural extended cervical spine.
There's a lot of research that can support starting to restore this natural curve, and go into exercises as well that help to restore this natural curve in our spine is going to help to reduce the risk of needing surgery. The tools that therapists, clinicians, chiropractors, physical therapists might use a lot is just having you starting to lay on what looks like a dowel that's kind of like in this upside down U shape, and you're starting to lean over it and just naturally start to build pressure of putting that neck in kind of what feels like an uncomfortable position at first, but putting your neck in that position. And even if you were to just lay down at the end of the day, especially if you sit at your desk all day and you're leaning forward toward a computer, if you were to just lean over that 5-10 minutes a day, that can even just start to restore it. But however, again, we can't just passively lay on something and expect change. We have to actively do some things too.
Or even just laying flat on your back without a pillow or something.
Yeah.
I mean, if you're not used to that, that can feel like, whoa, where's the ground? You know, like how far into extension do I have to go to just lay there without a pillow? And then working onto something like a half bolster or half foam roller, or using a foam roller at home if that's, you know, starts to become comfortable for you. But then, like you said, how do we promote stability? And one place a lot of PTs will go is a chin tuck, you know, just teaching a good proper, what we call cervical retraction, where you're kind of retracting your chin back and getting those deep neck muscles to activate and support the front of the neck. That's great, especially if you start to do that and then actively go into extension, which is kind of the next step, like getting that chin tuck and then actively extending. Chin tuck, active extension.
I've seen chin tucks and people kind of look down. And what you're doing if you look down when you chin tuck is you're just making that you're decreasing that curve even more, because you're going into more of a flex state of that neck. So you definitely don't want to look down. You want to think of kind of making a double chin kind of coming back, but also the top of your head is kind of coming up. So it makes you go back into that retracted position, which is going to help with that lordotic curve naturally. And we start to, now if you're laying down flat or you're laying down over that dowel, and you're starting to restore some of that range of motion, well, now we're doing it actively. So it's so important to not only do it passively, but to also get into those active states. And this is where it, you know, where can I do this? Can I do this just while I'm sitting at work? Just a couple times, if you remember. You know, can you do it when you're in your car? I love doing it in my car. Specifically, I can just kind of tuck my chin and lean back into the headrest. You have to go to pain tolerance as well. You want to make sure that you're not really pushing that envelope too much.
We're going to then start exploring maybe even some of those neck stretches that a PT might, you know, prescribe and say like, oh, do this to like stretch out your upper traps or stretch out the scalenes on the side of your neck. And they want you to do like a ear to shoulder stretch. Tuck that chin first, get that little chin tuck, and then start going ear to shoulder. And you might notice how much quicker you feel that stretch.
Start to tip the nose just a little bit different places. So if you tuck the chin, lean to the side, and now tip the nose up toward the ceiling. You get what's called like an SEM stretch a little bit. And then if you tip the nose down towards your armpit as you stretch over, you get a little bit more into that levator scap. That comes from like your scapular region or your shoulder blade up into the neck. But we don't want to just look at the neck, because what is the neck sitting on top of? Our upper back.
Ding, ding, ding.
What were you going to say?
This is one thing that I love to do when I do daily or in the morning. If I even just lay down and do a couple, what you call a W exercise, where you're just lifting your arms up and extending them, or to get both upper back extension and neck extension, just propping up on your elbows, pressing up on your hands a few times. That's going to be great to just mobilize upper back and neck together a bit.
Because if you think about it, if I round in my upper back, so you just sit there and kind of round into that upper back, it's automatically kind of jetting that chin forward. And it's hard to kind of get into a good position here, right? But then if I think of kind of lifting my upper back, keep the rib cage down. We don't want to overextend from that low back, but keeping that rib cage down, can I lift into my chest, my sternum? And that automatically aligns my neck without having to do anything in my neck. Learn to use that breath on the sides of the rib cage. We kind of help to stack that body more naturally, which automatically is going to stack that neck without, again, having to do so much. So when we're talking about those change of postures, those change of positions, well, what if I just think about breathing from my low rib cage and expanding to the sides of my low rib cage? All of a sudden, I'm sitting up taller, my posture is improved, I'm not putting so much tension on my neck, and there's not so much pressure where I feel like I need to stretch it out all the time, right? You can still do the laying down on your back in the passive extension. You can still do the chin tucks. You can still do all this stuff, but we're starting to now mobilize and put our body just in a better place naturally.
Yeah, no, and I think that's huge. I mentioned this on multiple podcasts before, that when I start getting my upper back and neck pain, if I just focus on doing a few breaths to the ribs, like that resolves it more than anything, more than like trying to crank side to side, or wrap your band around your low rib cage and then put your dress shirt on and work for an hour with that thing around there. And kind of every time you think about it, think to take a deep breath right up against that band. And you can keep working while you're doing this. And then every time you notice that band down there, just be like, okay, breathe into and expand my ribs against that band. That's going to go a long way to kind of setting that core so your upper back and neck feel like they have a stable foundation to rest on.
And then we're not breathing from the neck so much. Like a lot of the times those neck muscles get overused when they're not necessary. The only time we should be using our upper neck and our upper trap when we're breathing is if we're doing like a heavy activity, or we're really going on a sprint run several times, right? But otherwise, we shouldn't be using these muscles around the neck. So if they're always turning on, we need to come back to what's happening at the rib cage. Gaining awareness of your body, I think, is so extremely powerful in order to help you heal. There's no just one exercise. There's no just one tool. There's no just one manipulation that's going to get you out of pain. It's really putting all of this back together. And let's talk about a little bit what your dad did.
He ended up getting what is more or less a disc replacement, or a disc, I don't know what they would call an arthroplasty. So they essentially are replacing that disc joint, which is a relatively newer surgery, but has a fairly high success rate for people that end up going that route. And it really, as soon as he came out of surgery, he's like, wow, that alleviated my symptoms almost completely. And then he was able to start working back into a lot of those exercises quite a bit more. So, not to say that surgery isn't going to give you a lot of benefit. And there are different routes that a surgeon may recommend depending on your situation. There are microdiscectomies, which they kind of just go in and try and take out a portion of a disc that is extruding or sequestrated. There are laminectomies where they take out a bit of the bone actually to provide more space. Sometimes they might come in conjunction with fusions to give that lower spine more stability. Again, we could give some of our thoughts on those, but I think our main thought is, before going to any of those, making sure we're trying a lot of the conservative routes, which my dad did, before saying, hey, I'm losing strength, I'm losing some of my muscle mass. And that was for him. After a few months of that, he's like, I need to start talking to a surgeon more seriously. Of course, with the new Gen Health platform, there is a whole neck and upper back plan. So anybody out there who does just have general neck pain or has been dealing with a nagging neck issue that they haven't been able to resolve, go check out the Gen Health platform. There's a free week where you can hop in, try the free week trial, get into that neck and upper back plan. And Gen addresses a lot of these different areas, whether it is finding stability in our core all the way to our rib cages, or working our shoulder blades, doing neck stability exercises like the chin tucks. You'll find that all in there. Thanks again for tuning in to another PT Pearl from the Optimal Body Podcast. Subscribe to this YouTube channel if you haven't. Clang the bell. I think it's over here. So you can get notifications on any of the new PT Pearls and episodes that we come out with. Leave a comment below if there's an episode that you haven't seen us do that you would love to have delivered to you via our podcast. And of course, we'll see you next time.